I didn't even start my 20s or barely in my mid-20s even knowing that I was going to be a doctor, nonetheless a psychiatrist. And through a lot of serendipitous meetings in college, found my way into medicine. And I've always loved working with kids. Most people would call me a perpetual teenager. I got into pediatrics a little bit and really decided that I wasn't in love with the traditional healthcare system, the 15-minute well-child appointments, poking kids, making them cry. I knew I still wanted to work for kids, but that wasn't the field for me. And then I met a wonderful professor and attending who was a child psychiatrist. From the second I walked into his office and saw toys and books and got to see the passion and joy that he had for his patients and that the patients had for him, it was pretty clear where my path was headed. I also took part in everything from nutrition education and supplements, acupuncture, nutritional oncology, and was really able to get a deep dive into other ways of holistically treating the whole person. Really opened my eyes to this whole new world of patient care. And I saw that you could do a lot of good. The connection that you make with patients, the connection that you make with families, break cycles of turmoil and trauma that, have perpetuated some families for generations. For me, it was really about this idea that I could use my talents, my passion, and my drive to help improve the quality of life and decrease suffering for my patients in a way that I really don't think any other field of medicine is able to do. There's this kind of long-held, misassumption that I think is starting to go in the right direction, that, the brain and the body are these separate things. The mind, doesn't affect our health. And I think anybody that's been touched by suicide, by depression, by anxiety, probably has a pretty good idea that our brains and our mind absolutely are a big part of who we are and our physical health and our well-being. And I think really at the end of the day, the reason why I'm so passionate about working with people when they're in the beginning of their lives, or children, adolescents, young adults, is because if we can change their course early on, it really gives them the best opportunity to make the most out of their lives and do what they want to do with themselves. And hopefully, if a cycle of dysfunction, abuse exists, if they decide to have children, maybe I can be part of them being the kind of parent that they wish that they had.